Welcome back. The World Health Organization says about 40% of the world's population is affected by headache pain. That's about 3.1 billion people. So today we're going to introduce you to a clinic that only provides care for people who suffer from headaches, and it starts with a focus on lifestyle and long-term relief. Kari Hart is the CEO of Mind Neurology, and Kari Hart is an occupational therapist there. They're joining us with more information on their holistic approach to headaches. Great to see you guys. Thank you so much.
Great to see you.
Excited to be here.
Excited to have you. Kari, let's start with you and talk a little bit about the Mind Plus system and how it works.
Yeah, so at Mind Plus, we talk about striving for 5, which is about helping patients achieve less than 5 headaches a month and getting there in less than 5 months. So that's our focus with every patient. That's our promise to our patients. And we have a system that we've developed to be really effective to achieve that. And that's one of the things we want to then talk about and focus on today. Is one of the 4 core aspects of that system is what we call NeuroIntegrative Therapy. And that's where Kari comes in.
Okay,
Yeah.
And you guys are married. I just wanted to mention that.
We are.
You're in the
Happily.
business. Yes.
Very happily.
I love that you're a team, though, in this, because I know you're both passionate about helping people get better, and I think that goal is so wonderful. That 5 and 5 idea. So strive for 5. Let's talk about it, Kari. You're part of the NeuroIntegrative team approach there. What is it that you do when you see patients who are getting treated for headaches?
So NeuroIntegrative Therapy takes the holistic side of headache medicine versus, pharmaceuticals. So we sit down with a patient and we go over a treatment plan that works for you, that can be tailored to you individual, but we do understand that there's concerns that come with headaches and migraines, like increased neck pain can cause some issues. We see a lot of dizziness, vertigo, some balance issues. So really working with you to have a variety of treatments that are going to make you successful when you go home.
And do you find that if you treat some of those things, like you mentioned the ear issues, or let's say someone has really severe kind of chronic neck pain, do you find if you treat those things that it helps in the striving for 5 and gets those headaches to a much more manageable place?
For sure. I mean, the goal is to reduce your headache days and to just improve your overall quality of life. So.
Okay, let's talk about the types of treatments that you offer. So when you evaluate someone, does it have a lot to do with things like alignment and muscle control, if you're talking about the neck, et cetera?
Sure. We're going to look at someone as a whole person, not just, one thing here, one thing there. So we're going to look at trigger management, all the things that can contribute to your headache and the problems that you're having. And then really breaking that down to really see what is the focus for the patient and working with them to come up with a realistic and a treatment plan to make them succeed at home.
One of the things we're looking at here is IV treatment. That's one of the ways that you treat people who come in, I know, to the walk-in, the urgent care for headaches, right?
Yeah,
Right.
absolutely.
Is that's part of it too?
Yeah, absolutely. So I mean, it's all about. And this is why we talk about this system. It's all about everything that we can bring to the table, whether it's this holistic approach, which is critical, beyond just medicinal therapies and beyond just urgent care. These are all critical tools. But then neurointegrative therapy coming in with looking at your musculoskeletal system and how that contributes to your head pain, as well as trigger management, lifestyle management, all of that. There's just any different way we can possibly help improve and get our patients better, faster. That's what we're going to do.
You mentioned trigger management, Kari. So what does that all entail?
So it's going to look different for every patient. All of the things that you do in your daily life that affect you, right? So for some person, it might be the lights at the grocery store. Another person, it might be their stress that they have, and that's affecting their quality of sleep. They're not getting enough sleep, which is bringing on those headaches. Another person could be that they're having increased neck pain that is really contributing to their head pain. So it's it's finding what works for that person and giving them the tools to reduce those triggers so that they can, lower that migraine threshold.
So sort of identifying them and trying to manage them. I'm sure posture too is part of it, when you talk about necks and things like that.
And one of the things that I think is really cool about Kari's approach to this with patients is there's treatment that you offer in the clinic, but a huge focus is on giving patients the tools to be able to do it at home.
Yeah, almost
so
like
you're not
homework.
just having to come in forever, once a week, which a lot of physical therapy and stuff can be like that, where you're always going in. A lot of this is about giving you exercises and education that you can then take home that's going to then help you for the rest of your life.
And what are your top goals for patients when you see them as part of this neurointegrative team and this holistic approach?
Yeah, obviously, working with the medical team to lower your pain in general and focusing on your quality of life, right? Whatever quality of life you have now and what you improve or want to improve on, that's what we're here for. So, giving tools for migraine glasses or allowing you to help with your quality of sleep, how much sleep are you getting, and working with the patient, to have a team effort. Because we know best outcomes can come from working with the patient, working with your therapist, and working with your medical provider to really, take control of your own healthcare.
I love that.
And that's a big aspect. We talk about we're a comprehensive team. You're just not going to find that anywhere else, really, in any kind of specialty, where all of these providers with all these different points of view and expertises, they're co-located together, all focused on you, the patient. You really have a team that's working to help you get better from all these different angles, and that's how we've been able to be so successful and helping patients get better.
It's striving for that 5. It's great to have you guys here. Thank you so much for sharing more about your holistic approach. And if you've been suffering with headaches and migraines for way too long, or maybe you know someone who has, you can contact the experts at Mind Neurology. The main phone number is 888-585-7975, or you can visit their website for more information. That's mindplusclinic.com.